Gravity hurts. So good. Strange things can happen to the human body when people venture into space, and the familiar pull of gravity vanishes. Gravity hurts. You can feel it when lifting a loaded backpack or pushing a bike up a hill. But lack of gravity hurts too. When astronauts return from long term visits in space, they sometimes need to be carried away in stretchers. Gravity is not just a force, it's also a signal that tells the body how to act. For one thing, it tells muscles and bones how strong they must be. In zero G, or zero net gravity, muscles fade quickly because the body thinks it does not need them. The muscles used to fight gravity, like those in the calves and spine, which maintain posture, can lose around 20% of their mass if you don't use them. Muscle mass can disappear at a rate as high as 5% a week. For bones, the loss can be even more extreme. Bones in space break down at a rate of about 1% a month, and models suggest that the total loss could reach 40 to 60%. Blood feels gravity too. On Earth, blood pools in the feet. When people stand, the blood pressure in their feet can be high, about 200 millimeters of mercury. In the brain, though, it's only 60 to 80 milligrams of mercury. In space, where the familiar pull of gravity is missing, the differences between blood pressure in your feet and head disappear, and the blood pressure becomes the same throughout the body. That's why astronauts can look odd. Their faces, filled with fluid, puff up, and their legs, which can lose about a liter of fluid each, thin out. But that shift in blood pressure also sends a signal. Our bodies expect a blood pressure difference. Higher blood pressure in the head raises an alarm. The body has too much blood. Within 2 to 3 days of weightlessness, astronauts can lose as much as 22% of their blood volume as a result of that mistaken message. This change affects the heart too. If you have less blood, explains Dr. Victor Schneider, research medical officer for NASA headquarters, then your heart doesn't need to pump as hard. It's going to atrophy. This means that even your heart gets weaker. The question is, do such losses matter? Perhaps not if you plan to stay in space forever. But eventually, astronauts return to Earth, and the human body has to readjust again to the pull of gravity. Most changes in the body caused by lack of gravity appear to be reversible, but the rebuilding process is not necessarily an easy one. Each of the parameters have their own normal recovery time, says Schneider. Blood volume, for example, is typically restored within a few days. Astronauts get thirsty when they come back, Snyder explains, because their body says, you don't have enough blood in your blood vessels. And that causes the messengers to say, drink more. Also, the body doesn't pee as much. Muscle, too, can be rebuilt. Most comes back within a month or so, although it might take longer to recover completely. We normally say that it takes a day of recovery on Earth for each day that somebody's in space, says Schneider. In other words, if you spend 30 days in space, you can expect to require 30 days to regain your normal muscle mass. Bone recovery, though, has proven problematic. For a 3 to 6 month space flight, says Schneider, it might require 2 to 3 years to regain lost bone, if it's going to come back. And some studies have suggested that it doesn't. You really have to exercise a lot, says Schneider. You really have to work at it. According to Dr. Alan Hargens, recently of NASA Ames, and now a professor of orthopedics at the University of California, San Diego Medical School. It is important to keep astronauts in good physical conditions. You want the crew members to function normally when they come back to Earth and not have to lie around for long periods of recovery, he says. And Earth isn't the only planet that astronauts might visit. One day, humans will journey to Mars, a 6-month trip in zero G, before they disembark on a planet with 38% of Earth's gravity. We'll have to maintain those astronauts at a fairly high level of fitness, explains Hargens. When they get to Mars, there won't be anyone to help them if they get into trouble. They will need to be able to handle everything themselves. Exercise is key, but exercising in space differs from exercising on Earth. Here, gravity's pull automatically provides a resistive force that maintains muscles and bones. In space, even if you do have the same amount of work that you are doing down here on Earth, you miss that gravity component, says Schneider. Figuring out how to keep astronauts physically healthy in an environment without gravitational forces on the body is important. And not just for astronauts and future planet hoppers. Solving these problems, says Schneider, could lead to better therapies for people who aren't using gravity properly here on Earth. Aging is the perfect example. Zero G living mimics closely the effects of old age. Like astronauts, the elderly fight gravity less. They move less, which triggers the muscle loss, bone loss, and lower blood volume. If researchers can identify the signals that generate strong muscles and bones, it might be possible to get new pills and do exercises that would trigger those signals here on Earth. We've just begun to do research, looking at the changes that can happen to humans, says Schneider. There are so many wonderful questions. And the answers? They're waiting for us, up there in space, where the absence of weight reminds us that gravitation isn't all bad. Sometimes it's a struggle, our daily contest with gravity. But now we know the struggle is good.